most famous physical therapist on the internet.
Hi, folks. I'm Bob Shum, physical therapist.
Brad Heineck, physical therapist.
Together we have the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So today we're going to show you how to apply traction decompression to the neck or a pinched nerve with an over-the-door traction device. It's inexpensive. It's a different way to do it. It's not a manual way where you're applying it yourself, and it's not the most expensive way. It'll work, but we have some guidelines here. We wanted to show you what it looks like right here now, just to start off, and then we're going to take it off. But so what you have is you have a pulley system here, 2 pulleys. This part slips up over to your door, so you got to make sure it's a door that's not being used or not, somebody's not going to come through. It comes down to a bag. I actually have an extra weight on the bag because I didn't want to fill up with water. But the bag can be filled up with anywhere up to 20 pounds of water. And so you can apply 20 pounds of pressure. This harness here is not the one that comes with this unit. I saw so many complaints about this harness, the one that comes with the unit, that I ordered this separately. And it is a better harness, but I thought this one was fine, to be honest with you. I thought it fit me okay. And I think people were just putting it on wrong, possibly. Mm-hmm. So why don't you take it off right now, Brad? We got an idea.
Sure.
You may have to actually, we can show this when you take it off. You may actually have to face the unit because I like the neck to be in a little bit of flexion, like 20 degrees. And what we should say right now, what we're going to highly suggest is that you do not try this on your own. You should first get instruction from a physical therapist or a chiropractor. And once you've tried it maybe 2, 3, 4 times and you feel comfortable with it, then you can purchase a home unit. And they're only like $20. I don't remember. If you got an extra harness, it's going to be more. But and then you can apply it on your own at home, maybe with the help of a loved one or a friend.
Yeah, it's difficult to do these all by yourself. It's much easier with a second person, and I've always recommended have a second person. I've wore both of these, Bob, and I agree. That one I've always been able to get the fit right. This one is a little more comfortable.
It is a little more comfortable.
It's got this nice soft fabric in here. But
it's made a lot better.
Yeah, yeah.
Now, one thing, we believe the back, if you look at this, on both of these, you should want to hold that one, Brad. On both of these, I believe where the straps are attached, that goes to the back.
Right, right.
And so, in fact, I usually label these when I work with a patient so that they can
chin,
and back.
I have as well.
And so if you put this on wrong, it may not fit right either. You know.
Yeah.
So and it's a little bit confusing. I mean, look at this thing. So it actually goes like this.
Yeah.
And these go up into the spreader bar, which is this bar right here. Mm-hmm. So we got the over the door unit part. This slides over the door. We got the pulleys. We got the rope. We got the spreader bar. And we got the bag. Right. You can fill up with up to 20 pounds.
And this should be done with the door closed. You don't keep the door open and it kind of wiggles back and forth.
Closed
or have you done it? Yeah. Yeah, because if someone opens it up,
you're in big trouble.
Yeah, then it's a problem, yeah.
Yeah.
So, yeah, this is a really nice cost-effective unit, but it's just a lot more hassle. But once you get it figured out, I've had people go home and use them on a regular basis after the instruction, and they knew how much weight was going to work, and you get a feel for it.
Right, and your therapist may have you, like I said, face the unit because we want your neck to be slightly flexed forward.
Yeah, so that'd be the door. You're looking at the door, and then the harness would be on as it was at the beginning.
Because the recommendations are like about 15 to 20 degrees of flexion, or maybe 30 at the most.
Sure.
But first off, we want to determine whether or not traction is even going to help you. So the first thing we do is we're going to do 2 tests that you can do at home by yourself. You can go ahead and first one, you can take your hands, put them up over your head like that. You can interlock your fingers if you want.
Good, tall posture, ears over the shoulders. Yeah. If you've got neck pain, you may not, be
able to get back there.
Right. So you're going to get back best you can. Push gentle pressure straight down. If that hurts, it's positive, and that means maybe this will help. But
Right.
you got to come from the other direction, underneath.
Yeah, there's
Behind the
little bones
ear.
right here. These two bones that stick out there, you want to put your palms, the meaty part of the palm, that bone should hit right there. And yep, and that gives you some good leverage. And you cup over the ears, fingers are pointed straight up, and you just pull straight up.
And if that your neck feels better as a result, or if you're having radicular arm pain, if that feels better, which you may not be able to do this very well with your arm if it's really sore because of the pinched nerve, then you're not going to be able to do this. But
You could have someone do it to you.
Yep.
You could have someone
Yep.
pull. Now, with that, you want to make sure that we know if the things are getting better. If you're getting pain down your arm, when you're doing traction, what we want to see is that the pain that's furthest away from you starts to improve first. So like if you had pain all the way into the hand, we'd like to see the hand pain get better first, then maybe the forearm pain gets better, then maybe the upper arm gets better, and then it hopefully goes away. So that's what we're looking for. Ideally, all the pain just jumps out of there and you don't feel it. But if it makes your arm pain worse, you're going to stop immediately.
right.
That's just a bad sign. So you determine that it's going to help. You saw your therapist. The therapist, usually I'm going to leave it to the therapist, but most of the time I start people with 10 pounds of traction, Brad. And 10 pounds, you got to have at least the weight of the head or you're not even really getting any traction.
Sure.
So start with 10 pounds. Do it the first day. You can maybe go for a couple minutes. See how you tolerate it. Maybe 3 to 5 minutes if you want to. See how you tolerate it. If it's worse, stop. Just one time is the first day. Then, if it was okay, it felt good the next day, you can do it up to 3 times that day.
Sure. Just other precaution. If for any reason you feel lightheaded or nauseous while it's going on, you need to stop right away, and then you're going to just discontinue. It's not for you. Definitely need to see a therapist or a doctor with those symptoms.
Now they had recommended, Brad, that you could go up to 15 to 20 minutes with this.
Oh yeah, I've done that.
Have you done that long?
Yeah.
That seems like a long time, but
I've always done it on the third, not until the third
Right.
visit.
Right.
The first visit, just 2 or 3 minutes. Wait till the next day. Everything feels good. Everything's better. Then I'll go to 5 to 10 minutes. Usually around 5. Feels good while you're doing it. They go home. The next day it feels good. There's no problem. Then I'll jump into the longer time. But usually I've never gone more than 20.
Sure. And it's funny. I saw one of these on an episode of Andy Griffin where Barney was in it, and they thought
Oh,
Barney
really?
was hanging himself. They were worried. They were trying to save him.
Well, they didn't
So-
have YouTube back then.
Yeah,
Bob.
back then, right. So anyway, this video is a part of a series of videos on treatment of neck pain.
Yep.
So you can go to bobandbrad.com, go to the program section, and look for the neck pain videos. And you'll have 20, 30 videos there. Pick out the ones that apply towards you. And once you find that, you can click on it and you can play it. And also what's available, Red.
Well, along with that, you can actually get a PDF printout with a written out preview or review of the video, which makes it really nice. You can write notes on it if you'd like to, so that it makes sense to you and you can remember what we talked about. And there's absolutely no charge at all. We don't even ask for your email.
Yeah, it's our gift from us to you. Yeah. The thing is, if it wasn't clear how we were going over things today, it's all in the PDF.
Sure.
So check it out.
Yep.
And happy hanging.
Oh, Bob. Why?